In this video, I'll break down the technique of soft tissue release to show exactly how to perform targeted pressure and movement. Restricted muscles can limit blood flow, nerve function, and joint mobility. This will reset tension patterns, improve circulation, and restore muscle function. I'm going to demonstrate soft tissue release, or STR, on the calf. Now, if we come in and have a look at my client's calf here, just have a look at the definition. If you point your toes, please, and can we see there's two heads to the gastrocnemius. We've got a medial head and a lateral head. And relax, brilliant. Now, when you're massaging this area, if you found particular tightness in the gastrocnemius muscle, for me, predominantly, most of my clients, I would feel tension more in that lateral head here. Now, if I stretch the calf using a normal calf stretch, it might be that I am putting them into this position to stretch, but I am stretching through the whole muscle group. To make STR specific, what we can do is we can focus on a particular area. So again, if we were doing the hamstrings, rather than it just being right in the center of the hamstrings, we could focus on one of the three hamstring groups. So I'm going to focus now on the lateral head of the gastrocnemius. Now, STR, we've got to do three things. Firstly, we have to shorten the muscle. So this is where your muscle knowledge comes in. And if your muscle knowledge isn't the best, I've got some great videos on that, so go and have a look. First thing I'm going to do is shorten this gastrocnemius. So I can do it passively here. My client relaxes. So all I have to do is take the foot into plantar flexion. That will shorten the gastrocnemius. Then I can locate the area that I want to work on, and I'm going to put a fixed pressure point in. Once I've done that, then either passively or actively with the client, we're going to lengthen it. Now, if I just talk you through before I do it, I'm going to find 3 points. So my first point is going to be quite high up in the muscle group. I would reinforce my thumb. And then as I extend the muscle or lengthen the muscle, the client will feel a stretch from here down through to the insertion on the calcaneus. The next point, because I do it 3 times, would be a bit further down, move about an inch or a couple of centimeters. And the third point would be further down here. So I'm doing 3 stretches right through that area of tension. So it's different to a normal passive stretch, because a passive stretch would be for the whole muscle group, and I'm doing it particularly for this lateral head. So now I'm going to perform it in real time. So my client is going to plantar flex. I'm going to apply some pressure, enough pressure here to fix that muscle onto the bone underneath. And now my client is going to take their foot slowly into dorsiflexion. So if we can see the ankle move, and the client hopefully will feel the stretch from here downwards. And relax, take the pressure off, move your thumb or elbow or fist or knuckles down 2 centimeters. You're going to fix that point there, and the client's going to repeat and take their foot into dorsiflexion. So now we're getting a stretch from here down through the muscle, and relax. I'm going to do one more fixed point here, and this is lower head of the gastrocnemius, and again take them into dorsiflexion. So we can do passive or active soft tissue release. You can see I'm doing this actively, and my client's working is an active STR, because I find for me to be in control of the ankle means I only have one hand, and I don't want to put all that pressure through my own thumb. So being a massage therapist, we need to look after our own joints as well. For my client to do it, I can now fix and reinforce, and they can do the action. So there are different parts of the body we can do this on, and I would experiment with either passively or actively. So have a go. So in summary, soft tissue release, what are the 3 points? Firstly, shorten the muscle. Secondly, put a lock in. Thirdly, lengthen. If you lengthen as a therapist, it's a passive STR. If the client lengthens, it's an active STR. And the technique is specifically good at helping to stretch specific areas of muscle groups rather than the whole muscle itself. And don't forget to like, share and subscribe. See you on the next one.